Papua New Guinea recently hosted the 8th Asia-Pacific Leaders Summit on Malaria Elimination from the 6th to the 7th of June 2022 in Port Moresby at the Hilton Hotel. It was a gathering of ministers and senior government officials, local, national, and global leaders united under the theme Invest to Achieve Zero Malaria. Malaria continues to pose a health risk across the Asia-Pacific region, and Papua New Guinea is no exception. Papua New Guinea's Minister for Health, Dr. Lino Tom, in his opening speech, mentioned that climate change and other factors continue to contribute to the spread of malaria in the country.
Although countries in the Asia-Pacific region have made great progress towards eliminating malaria, it is estimated that over 2 billion people remain at high risk. And sadly, young children and pregnant women are among the most vulnerable. The impact of climate change on the distribution of malaria is becoming increasingly evident. Malaria transmission is spreading to new regions due to increasing temperatures, flooding, and rainfall. This is the case in my province, Anga, where we are seeing cases of malaria in areas not previously affected.
Dr. Lino Tom mentioned that malaria is not just a health issue, it also presents a socio-economic burden to this country and the rest of the Asia-Pacific.
Malaria continues to pose a significant health threat in our region and can be a deadly disease if not diagnosed and treated rapidly. In Papua New Guinea, there are over 800,000 confirmed cases of malaria and 300 associated deaths in 2023. These statistics are sobering. Malaria is not just an health issue. It also presents a social and economic burden to this country.
According to reports by representatives from the World Health Organization, WTO has certified 8 countries as malaria-free and another 4 are in the process of being certified. This proves that the formidable ancient disease can be eradicated. But for Papua New Guinea, there seems to be an increase in malaria since 2010.
We've seen 857.3% increase in cases since 2010, from the number of 93,956 in 2010 to what is now sitting at just around 900,000 cases in 2022, and that accounts for 90% of malaria cases in the Western Pacific region and 23.8% of all cases in the Asia-Pacific region. So malaria continues to remain at the top 10 causes of death for Papua New Guinea at the present time.
The biggest problem facing Papua New Guinea in the battle against malaria is the lack of funding.
We are also experiencing an unfortunate decline in financing for malaria, which obviously compounds the challenges of rising cases, escalating costs, and competing domestic crisis. And the worrying thing, of course, is that if this gap in financing is left unfilled, then it will obviously threaten the hard-won gains in elimination.
Fidelis Sukina for Inside PNG News.